I'm Lou Hochheiser. Thank you, Madam Chair, and Commissioners, for giving me an opportunity to make public comment on what I think is a very important issue before us. Don't expect you to come up with an answer today. But the implementation of the 5G network is an issue that I think we really need to study and think through. I'm not going to rehash all the stuff that's been in the paper lately. Most of you know me as a hospital administrator, but I also have credentials as a clinical researcher and continue to do that and publish even this month. The current state of knowledge deploying with 5G networks in our neighborhoods could prove to be a really massive public health mistake. And you note that I said could prove to be, because the data isn't there one way or the other. And so the data is developing as we speak. There are pretty nice things that have been done with good researchers on both sides of the aisle. But the FAA, FCC hasn't put forth their position on the human safety for 5G networks, and yet we have legislation that's told us we ought to get going on allowing the 5G networks to be built. The legislation from the feds can be and is being interpreted differently in different parts of the country. So there are a number of cities and states that have taken this on and looking at it from a public health and safety perspective. If you look at the legislation and look at it very narrowly, you're going to see that we're forced to start the process of putting the network together. But if you look at it in a more liberal fashion, you see that there's leeway about how that network would go together, and if you did have 5G, where it would be placed relative to people. And right now the proposals are to put a lot of towers in our neighborhoods. And I think this is an unwise decision. The local park service has been successful, and they're the first park service that's putting in a new network. They're not going 5G, they're only going 4G, which in itself tells you something. But they've been successful getting all the major players to get together and have one network versus everyone having their individual towers. And that certainly minimizes duplication and potentially harmful effects of the radiation. I actually am going to end with 2 suggestions for you. One, asking our public health organization to provide advice to both the county and the town after looking at the data and what is being done around the rest of the country. And the second is, I would hope that you might be willing to express your concern with a resolution just asking for more information to be provided and the public allowed to become educated before implementation of the 5G. So thank you for your time.
Thank you. And just so the board knows, Jody Pond did share with me that you, I think, were going to come to the Board of Health meeting in May, and I did ask her to keep this board in the loop about those efforts. So thank you for doing that.
Thanks.